Raymond Théberge is the official language commissioner here in Canada. He is on the line. Mr. Théberge, thanks for your time this afternoon. Good to speak to you again.
Good to be here.
You know, last time we spoke, that's only a couple of weeks ago, I'm not sure this subject even came up at all. Now, I should mention, when I say the official languages commissioner, just so people understand, this is your post federally. You're not the Quebec official language commissioner, but you study a course and you hear from people across the country. So just to kind of give people, the idea of that's what you do. So When I read this morning, this part about Quebec where you write healthcare workers are now avoiding English due to confusing language rules from the government, which is threatening access to care for Anglophone Quebecers. It reminded me of a conversation that I had with Jean-François Roberge. This goes back to August of last year when this whole issue came into focus, right? The government had issued one directive, the OQLF had issued another, and there was confusion as to whether you would have to prove, you were a historic Anglo or show documentation. This is part of that conversation. I want you to hear what he said.
I think the English-speaking community were afraid or aware about their rights to be served and to get services about healthcare. And it's important to reassure that nothing changed about that.
So this idea in the directive, they had created a couple of situations. One of them being, let's say you go to the emergency with your daughter, she's injured. You as a parent or grandparent would only be able to get service in English or access to an English person to deal with you if you showed an eligibility certificate. You're saying that's false?
Oh, it is. It is. Absolutely. This is false.
This is false. Didn't need it. Didn't have to happen. What are you finding? Is that not the case, Mr. Théberge?
Well, I do remember that situation where there was a lot of ambiguity in terms of who could receive their services in English. What I'm saying here is we've had continued conversations with members of the community, and there still seems to be issues around that. And it's not necessarily the same. Maybe the same extent as it was when the directive came out, which by the way was very confusing for everyone, and they did pull back. So, but there are still concerns out there about how can we receive our health services in English. Those are comments that were made to us to our representatives who work in Quebec. So this is what we're saying.
Okay, so when you say this is what you're saying, this is what you've heard from people who've come to you to say this is what I'm encountering in the system.
Yeah.
Okay. The question then becomes, as unequivocal as what you just heard Jean-François Roberge say, it's one thing to say it and another to do it. And to your point about, if you're a patient, maybe that doesn't apply to you. What's even a bigger concern, if I read, the piece today right, is that people who are providing that service to you, they're the ones who are unsure what to do.
That's the point. Is that there is this uncertainty on the part of staff in terms of what am I supposed to do, and it all flows from ambiguity in terms of the directive. How clearly was this communicated? And what we're doing is we're sort of reflecting what we've heard in the report.
So I guess the question is, where do we go from here? What happens next?
Well, that's a good question. What I'm doing here is raising the issue. I think it goes back to, it's a provincial issue, obviously, but we're here to support sort of the official language community of Quebec, which is English-speaking community. So I think there needs clarity on the part of the appropriate ministry in terms of what the rules are. I mean, I think that's where what has to happen.
So I guess the question also becomes, you note the issue, you note the problem we're dealing with here, and obviously the government, someone will bring this up and note that, it's been brought to their attention. But in terms of what you can actually get done, how limited are you here?
Well, we don't have jurisdiction in the province of Quebec. If this was an issue dealing with the Official Language Act of Canada would be one thing, but this is purely a provincial issue. But when we do our review of community issues across the country, we'll speak to members of the community and we will put those on their table. It's not necessarily up to us. We don't have the jurisdiction to do something, but we do raise the issue, hoping that community members can then raise that issue with the appropriate people in government.
I would ask as well, I'm not saying that the minister, when we spoke to him, was not sincere at the time. I sensed he was. And as I said, until I read your piece this morning, I was not aware this kind of stuff was actually going on where people were so worried. Typically, we hear this kind of thing where employees don't really know, or city employees, for example, don't really know, who can get service in English or not until they either read them a text of some kind. We had that situation at a library a while ago where the person in charge didn't know if she could allow an English group to actually, hold a meeting there. English groups finding out about this and going to the government. Are you hopeful? I mean, in the past, when this kind of thing has happened, has change come?
I think that it is up to the community representatives, the community organizations to make the case for changes, at least the case for clarity. And it's been my experience over the last number of years that in other jurisdictions, when communities put forward certain ideas or they put forward that there are issues, that they work with government to try to bring about the appropriate kind of change. And in my understanding here for what it is there seems to be a lack of clarity around what the rules are.
Okay. Any suggestions for how that's fixed?
Well, I think, there has to be an engagement on the part of the government with their communities. And it is up to the community to try to seek that engagement. It is only going to happen if there's an engagement between government and the community.
We'll leave it at that. Mr. Théberge, appreciate the time. Thank you so much.
Thank you so much.
You bet. Raymond Théberge, Canada's official language commissioner. I think that's a story worth following up here. Yes, he's right. He doesn't have jurisdiction here, right? The complaints come to him, but then they make them available publicly, and then something has to make them change. So in this case, if it's community groups who have to take this and go to the government and say, hey, despite what you said, this is what's happening on the floor, right? On the ground. And what can we do to make sure this doesn't continue to happen where employees are unsure of who can get service in English and who can't? And why is this even still an issue when the government had said it should not be when it comes to healthcare? So I think maybe that's maybe time to reach out to Jean-François Roberge again and maybe get some clarification.
Unmistakably Canadian.
It's the music that raised you.
The artists raising the bar.
Hi, this is Bryan Adams.
Hey, my name's Brett Emmons. I'm from the Glorious Sons.
Hi, I'm Nelly Furtado.
Made in Canada. The station that champions Canadian music.
Loud, proud, and all yours.
No passports required. Just press play.
Tap into Made in Canada now on iHeartRadio.ca
or the free iHeartRadio app.